Yeah, patients are doing well. Everybody's concerned, but everybody's been reaching out. We've been doing a lot of telemedicine. So
Mm.
I've been on Zoom for like 12 hours a day for the last couple of days. And we've got a pretty good protocol set up. So if somebody's just concerned versus think they may have had an exposure versus exposure and symptoms, and then if symptoms look like it could be COVID or definitely not COVID, I have patients who are freaking out about diarrhea, and I'm like, we'll take care of the diarrhea, but you definitely don't have the virus, so that's a good
Right.
thing. Um, so yeah, patients are doing good. Staff is doing pretty well. We've had to make just some changes and modifications of hours and how we compensate and that sort of thing. We're trying to keep people on as much as we can. Um,
Hmm.
but we're making the changes. We're adapting. Our marketing team, I've been on calls with them all week trying to get like the promotions and the ads running. And we've actually been doing a handful of concierge IVs as well. So if somebody has no symptoms and doesn't know anybody who has symptoms, then we'll go into the house, mask, glove, the whole shebang, and do an IV party. So
Yeah. All right, so that's similar to what we're doing, like offering more telemedicine. I still have my patients who are getting acupuncture. Obviously, everyone's very concerned about immune health, but like you said, there's these different categories. Like, are you just concerned and you're perfectly healthy? Are you someone who, I've currently been treating for an autoimmune condition, so we need to be, really paying attention to that? Did you have something completely unrelated that we need to continue treating and then adjusting accordingly? And I've been transitioning new patient consults to all telemedicine, but then again, if they fit into that category of like no symptoms, don't know anyone who's had symptoms, then, we're able to do more of a concierge experience for that person. So I think I like seeing how everyone's adapting in this time and trying to figure out, okay, how are we going to continue to bring value? And that's like the purpose of all these IG lives that I'm trying to do with people every day is like, we all are adapting, but everyone still needs information. Everybody's still freaked out. We all have our daily needs that need to be met. And then how can we, with our own respective experience, contribute in some way to that? And with all the hype about, the immune system health, there's also a lot of things that are not being discussed that I think are, equally important. I'm treating a lot of patients who are dealing with depression, anxiety, low libido is something we're gonna, talk about now because this like high stress state creates this cascade of all these other events, right?
definitely.
Yeah. So I know your passion is sexual health. So can you like just go over what that means? Because there's a misconception with that too. I think a lot of people think that doesn't apply to them.
Yeah, absolutely. So a lot of people think sexual health and they think STDs, which
Hmm.
that's definitely a component. That's what's the most advertised out there. And that's not what we're going to talk about tonight. if you're holed up with your honey and you've got an STD, it's probably too late. Just enjoy yourselves anyway. Not official advice, by the way. Um,
Disclaimer.
disclaimer. Also, sexual health also includes birth control and birth control in all the forms, whether it's cycle tracking, knowing when you're ovulating, when you're not ovulating, or natural family planning, or hormonal birth control, non-hormonal birth control, all that sort of thing. We're also not really going to talk about that tonight. I feel like we all kind of have those things
Yeah.
down, and if not, there's lots of other resources. We're going to talk about the fun stuff, the libido, the arousal, the orgasm. Oh my. Um,
And how does that apply to now? Like we're all stuck in our houses.
yeah.
You know?
So one, what a great time to be even more connected to yourself, your body, or your partner, and how to do that when there's chaos happening in the world. So the nervous system is the largest sexual organ in the human body. And there are some men who would beg to differ or who would beg to disagree, but it's all about the brain. And so we've got two parts of the nervous system, at least as far as this autonomic nervous system, the automatic nervous system. So we've got the parasympathetic, which is the rest, digest, and heal. And we've got the sympathetic, which is the fight, flight, fight or flight, essentially.
Mm-hmm.
And sex, libido specifically, usually happens more in that parasympathetic rest, digest, heal, and procreate mode. There are some people who need certain types of stimulation, but that's like, again, a different conversation, a little more on the kinky side. Team is gonna love that I'm like, I swear I sound like I had a glass of wine. My team is gonna love this. But we're being real, so here we are.
Exactly.
Yeah, and then what's also interesting is we need both parts of the nervous system for healthy sex. So the parasympathetic is more of that libido and arousal. But for men to orgasm, we need that sympathetic stimulation as well. Right. So it's like PS, parasympathetic, sympathetic, point and shoot. So parasympathetic to get an erection and maintain an erection, sympathetic to ejaculate. Women tend to do a little bit better staying mostly in the parasympathetic mode, but I also don't think anybody's actually tested it or checked it because there's just not a lot of research on the female orgasm, and I think we should change that.
That would be interesting. There's a need there, I'm sure.
Yeah.
Okay. So I'm thinking like that also probably contributes if you're like, you know, okay, I'm having a glass of wine to relax. That's a depressant. It's putting you more in that like parasympathetic state, which, you know, people have noticed like, oh, okay, you know, once I take the edge off, I feel a little more into the idea of having sex. So how is this current climate affecting everyone's sex drive? Because it's stressful. Like people are in that very sympathetic state all the time. How do we bring that down so we can actually enjoy the parts of this that we want to enjoy?
Absolutely. So the first step is turn off the news, turn off the TV, turn off the media, turn off all the screens once you're done watching us, and go try all these tips. Get rid of all the outside noise and really set an intentional space. So whether that's for you, whether that's for your partner, and get into the senses. So the senses will help get into that parasympathetic mode much quicker. And that could be breath. So just slow breaths in through the nose, out through the mouth. That helps the parasympathetic nervous system. Movement, so slow movement, either some dancing. You know, you're not going to go do like a heavy lifting workout in your living room, although exercise does improve libido as well, from different blood flow and hormones. So I suppose some body weight squats to increase blood flow, but
yes.
to really relax.
Might work out.
Yeah. So intentional space, sensuality. So that's one of the things that wine helps with. So there's the alcohol component that is the depressant. And there's also, usually people are going to savor that flavor. It's an experience. You're going to swish it and smell it and do all the things. So that helps too. And you can do that without wine. So you can do that with your own body. So you can just close your eyes, take a breath, be present with yourself. Just run your fingertips over your arm or your hand or your leg, or sit with your partner, look into each other's eyes. One of my favorite things of all times is eye gazing. So it's very connective. For those who've never done it before, it can feel awkward at first, which also creates more intimacy because then you're like looking at each other and kind of like giggling a little bit.
Yeah.
And the first time, and I actually had a teacher, a mentor who had me do this with myself as I was doing some self-healing work. And she told me to sit in front of the mirror naked and look into my own eyes. And I literally burst into tears as that was like my healing journey with myself initially. You don't need to do that part tonight. We're going to get back to the sexy time. So eye gazing with your partner, super, super intimate, romantic. You can get a fire going. So sense and smells, tastes, a little dark chocolate, like even if it's not, even if you don't have the dark chocolate, if we're in like quarantine kitchen and we've got maybe a macadamia nut and what else, it's all about what you do with it. So you can literally put it in your mouth, close your eyes, let yourself taste every little bit of saltiness, sweet, fatty, creamy, whatever it is that you've got in your mouth. Just really actually taste it, because most of us run through life and don't taste our food, don't smell the roses, don't see what the heck is going on. So, you know, we've got touch, smell, taste, sight. So get a nice fire going, light some candles, get the light low, and sound. So whatever music you like, or maybe the crackling of a fire, but really create an environment that speaks to the senses, and that will help drop you into that parasympathetic mode pretty quickly. And those are all romantic things, like it's no accident.
Yeah.
So, and another few tips that I've learned from other people who work in the more energetic sexual space is keep the room a little bit warmer than you would typically, and that will help people want to take their clothes off.
Yes.
It makes sense, but sometimes we forget. And then also close doors and windows. So kind of like create an actual container, instead of, and even if there's like a big gap under the door, maybe like put a towel or something so that all of that energy that you cultivate in that connection it stays in that room. Nothing's kind of like going outdoors or windows, and it creates that safety aspect, which the parasympathetic nervous system needs to be able to relax the body and get things going and juicy.
Yeah, I think that's a really interesting crossover too with like the Eastern medicine perspective around like issues with libido. So, a lot of those tips would be very similar to something that in my practice, even though we don't do the same in-office procedures that you guys do at Gentera, but like those same types of tips, particularly like, okay, we don't like windows open at night, like there shouldn't be wind coming in, like, having things be a little bit warmer. We're not stepping on the ground with like cold bare feet, in order to put the body in a more optimal state where, like sexual arousal and intimacy is very natural. It's in that parasympathetic realm, but we can get shaken out of that so easily with everything that's going on. So if you're looking at any type of health optimization, all of your things are going to improve. Like they're just symptoms of something going on underneath. So, we were talking earlier and you're like, yeah, I'm sure there's like some acupuncture points you could do. We have really cool in-office procedures, but if your foundation is not there, and so it's about control the controllables, right? Like we're in a very scary, chaotic time where we feel like we don't have control over anything, but you just listed a bunch of tangible stuff that we absolutely have control over. So it's exciting that people can kind of dive into those areas and say like, oh, okay, no, like I can absolutely control the temperature of my house right now. I can take a moment and look at my partner. But what about like those people who are in their homes by themselves? Do you recommend like same types of tips? What's the difference there?
Yeah, I actually recommend the exact same things. So you are completely worthy of creating the most sensual, sexual, beautiful experience for yourself. So candles, essential oils, or flower. I don't know. Are grocery stores even selling flowers right now? I have no idea.
I don't know. Maybe if you have flowers already in your house or plants already.
But same sort of thing. Create a beautiful environment for yourself. And even if you're not gonna, masturbate or anything, like let yourself really come into that parasympathetic state, because we have an opportunity now to really slow down and rest like we've probably never had in the known history of the world at this point, or at least in modern society. It's been kind of go go go, at least since the Industrial Revolution, probably way before that. And so that parasympathetic mode, yes, like sexy time happens there, but so does all your healing. So right. And sex can be healing too. Like we know that orgasms, and we know that sexual activity, sex twice a week for a couple, and decreases both of their risk of heart disease, heart attack, stroke, high blood pressure, improves hormone balance. Like it's the twice a week that's like the minimum effective dose apparently. But there's lots of physical benefits to a healthy sex life. So a lot of patients have trouble getting to that twice a week for whatever reason, whether it's the stress, which is common right now, can also be hormones, which are also affected by stress. We know that that stress depletes, uses up lots of cortisol, and as the body makes more cortisol to handle stress, it decreases all our raw ingredients, which make the rest of our hormones, and those go down. And testosterone is one of our big libido hormones, both for men and women. And one of the ways I love to increase testosterone is either working out, especially like heavy leg workouts for both men and women. You're also getting the increased blood flow. And then zinc. So oysters, if we can. I actually had a patient text me a picture of a dozen oysters yesterday. So they're still selling oysters.
Okay. Well, and I always feel like oysters are on that aphrodisiac list. So is that due to their effect with blood flow?
So the zinc, the minerals, will help improve the testosterone, and there may be some blood flow benefits as well. May also be a little bit of the sensual piece. They have a very particular texture and experience.
Yeah.
But we know that the zinc mechanism and the testosterone mechanism for sure works with the oysters. And even if you don't have a partner, get yourself a dozen oysters. With it. So.
And everyone could benefit from zinc right now. Like there's so many options that like it's great for your immune system too. It's a perfect time to get yourself into parasympathetic and enjoy some zinc-filled foods.
Definitely. What do you tell patients to do, libido-wise as well? Like I love the no cold feet thing. Like that's that annoys me, but I've been thinking like clinical, so I love that.
Yeah, no, it's really interesting because when you look at libido from a Chinese medicine perspective, there's really like two main areas that we're looking at. It's either based on stagnation, so things are stuck and you can't have everything flowing properly. Like, you think you're stressed, everything gets really tight. Cold also causes stagnation, so it tenses everything up. And if things aren't flowing properly, even if you think on a very basic level blood flow, you're not going to have a proper libido. So that's why so many people suffer when it comes to stress influencing their libido, because stress is all about stagnation. And then the other pattern with that is more of a deficiency pattern. So, a lot of times you see this as people age. We just naturally have less substance to the body to like get that fire going. It's then more about, okay, how do we preserve the energy that we do have and then funnel that to the proper place? So it's either based on this deficiency or this excess, like things are getting stuck and they can't move properly. So a lot of times herbs based on those individual diagnoses are really helpful for libido. You just need a practitioner who can very well identify like, where is this coming from? And that's what's so cool about the holistic approach. Like, two patients could come in both having symptoms of low libido and their treatment plan is going to be completely different. But that's also why I'm loving what we're doing right now, because anyone can do those take-home tips. I'm still offering telemedicine consults, so people do need a more customized herbal approach. If they need, points that they can do for acupressure at home, like we can go over that. But everyone's pretty safe just putting themselves into parasympathetic more often with everything that we have going on. So that's like the biggest bang for your buck right now is like, okay, guys, we know we're stressed. We know there's a lot happening. So can we give our nervous system a little bit of a break? And I see that affect men a lot more than women, actually. And a lot of people think like, oh, it's men who have the crazy sex drive. Like, no, men are very susceptible to getting that switched very quickly. And I think it's what you spoke to earlier about they need parasympathetic and sympathetic. And if we're in sympathetic so much and we're losing that idea of how do I switch back and forth, that's very difficult for a man to perform both of those functions in a short period of time and be able to switch that properly.
Yeah, definitely. Yeah, and I've seen with the mind-body piece with men, there's both the stress component of like, maybe they're at work hustling all day and then come home and, they've got a family to also take care of as well. Mm-hmm. And also there's like specific emotional pieces I've seen with men that they're not very likely to admit. So I've had a number of men in the last few weeks. One is a couple I'm working with for fertility. And he didn't start having issues until after we started working together. And, upon further inquiry, found out that he has some hesitation about, them getting pregnant again. And mm-hmm. So, it might not be like there's just too much stress. It's like something very specific in his brain is preventing that action because he's concerned about that specific outcome.
Right.
And that takes some specific coaching and some mind-body work. And I've got techniques that I use with my patients, whether it's for fertility or other things that really work with the brain as well. You know, so it, that the brain really is the largest sex organ, even beyond just the parasympathetic sympathetic balance and whatnot. And one of the things we have in the clinic. So once everybody's got the foundations down, then we can really play and prescribe some of the fun stuff. So one of the things we have is this Eros nasal spray, and it's actually an FDA-approved peptide called PT141. And literally, it's just like a spray up each nostril, and it works on the central nervous system to improve libido, arousal, maybe some orgasm. We got other things for orgasm. But what's cool about it is that because it works on the central nervous system, it's a very different mechanism than like a Viagra or a Cialis, which are all blood flow. So those are all about increasing blood flow to the pelvis, to the penis, to even the vaginal tissues. Tadalafil or Cialis can be taken by women as well. But this Eros nasal spray works very well in men and women, and I think it's because it works so much on that central nervous system. And it's not necessarily doing the sympathetic parasympathetic balance. It's a different mechanism, but it's really fun.
Yeah, no, I'm right there with you. Like, I love when you look at, oh, this is not just the basics of like, how do we get more blood flow to that organ? Like, we're looking on a much more holistic level, and how are things really controlled? Like, I do that with herbs. I find the herbs fascinating that, oh no, we're working mostly on your liver and your stress levels, and that's what's going to improve your sex drive and your ability to orgasm. Like, it's incredible.
I love it. Do you do mostly Chinese herbs or Western?
Yeah, I do a combination. So definitely Chinese herbal formulas to keep it super customized to whatever that underlying diagnosis is that's causing any type of dysfunction. But we also do customized blood work as well. So if there's like a very clear deficiency of a micronutrient and whatnot, like there are, things we can supplement there. But I mean, I love working with Chinese herbs, and now like everyone's buying up the immune formulas. So it's so interesting to see like general population asking questions about, oh my gosh, what can I be doing, to protect myself right now? What can I be doing to keep myself in, good health? So I think that's also why this conversation is important, because it's not just about, okay, I'm going to take this to get this result. There's so many holistic things you can be doing in your day-to-day, whether it's working out, eating the right foods, you're going to get acupuncture, you're getting IVs, or, you're at home having a good sexual experience with your partner or with yourself. So
I forgot to mention, I mentioned all the cardiovascular benefits, but sex also boosts the immune system. So while you're home,
sex just does everything.
Everybody.
And with the like studies that you've seen, so you said like twice a week is, like that sweet spot for when you start to get the benefits of, like sex twice a week. Is that the same benefit as like 2 orgasms a week? Is there additional benefit to like having that intimate relationship with another person at the same time? Can people still get benefit on their own? Like, what does that look like? Has there been research on that?
I haven't seen research on masturbation. So, but I would assume that it would be similar, although there may be additional benefit to having interaction with another person in that respect. They also didn't really look at orgasm. So it was just, it was basically a survey, and then they measured different markers. But it wasn't like, did the woman orgasm?
Okay.
I mean, the men finish, but
no, I'm good on my end. Are you
okay.
good? Did we freeze for a second?
Yeah.
As we're talking, if you guys have questions who are watching, go ahead and put them in the chat. I know people have been kind of like filtering in and out, so you might just be popping in and you're like, wait, what's going on? They're talking about orgasms now.
Which I think there is a benefit there. I think there's an additional benefit to orgasm just beyond, intercourse or sexual activity, because we know the oxytocin, the serotonin, the dopamine, all the beautiful neurotransmitters and hormones that get released. That also support immune health, and they also support calming the nervous system. So it's kind of like this beautiful feedback loop. Like, you get into the parasympathetic to get into sexy time, and then sexy time gives you more parasympathetic and kind of keeps you on this even keel, because there's some emotional benefits as well, mood stability with regular sex as well. So yeah, use it or lose it.
There's dosage for everything.
Yeah. Yeah. This might,
even for sex.
I don't know if this is one of the things that more is better. It might be.
That was going to be my next question, is like more than twice a week, do you get even more immune boosting benefits? Do you get like even more, I mean, I would assume you would get at least more parasympathetic time. So
definitely more parasympathetic time. I think we might need to study that. I think
we
might enroll some people in that trial.
Absolutely. All right. Well, any last words? I'm going through here just to see if anybody had any questions that we missed. A lot of people saying hi. Hi, everyone. Thanks for joining. But yeah, I loved the tips that you gave for people like specifically now at home, either by themselves or with a partner. But any last words about how people just, want to stay calm, enjoy sexy time during these trying times that we're having?
Just that it's a great tool. It's very natural, and it's a wonderful thing to be doing right now, especially with somebody you love, which could be yourself. And feel free to reach out if you have any questions. We're at Gentera Med. I'm at Dr. Zagone, as you can see. And we do, we're doing telemedicine right now. So if you do have sexy questions or need an antiviral IV, we are here. We are healthy, and we are working. And we have a whole suite of sexual wellness procedures as well, which we didn't get into today. But like we said, you got to get the foundations down first, and then we can play with all the more advanced fun stuff. So we'll get there. But Dr. Nell, thank you so much for having me today. This was super fun.
No, I'm glad. We're trying to do these every day, you guys, these IG lives. I just want you guys to continue to have value. I know everybody for the most part is at home, with the exception of us on the screen right now. We're